For first-time users coming in for neurotoxin, we routinely recommend somewhere around 20 to 30 units of branded Botox. That may be more depending, again, on patient's muscle movement. Everything is quite individualized. It also depends on the surface area. So if someone's coming in and they're more concerned about glabellar lines, so scowl lines here between the brows, that may be a little bit cheaper than someone who is looking at getting, the scowl lines, their frontalis or forehead lines. They're also worried about their crow's feet, and maybe we're discussing lower face injections as well. So if we're treating numerous areas, obviously that's going to be much more expensive. But usually the first-time user, especially if they're very young, probably around 20 to 30 Botox units. If someone is much more advanced in age and maybe it's been a long time since they received injections or never received injections, likely it would be much more expensive. That could be $800, $1,000, if we're doing much more extensive treatments, but we would expect around $200 to $400 probably for a new time patient for botulism toxin. So with botulism toxin, everyone responds quite differently. So how I will respond to how you will respond to how all the girls here at Plaza Aesthetics and Wellness will respond, it's quite variable. So I know I can just give an example of myself. When I first started getting botulism toxin, I was getting more units, and then I was able to get some of those muscles to relax a little bit more while I was doing treatments where I was now placing the product in my lower face. So I was treating my platysma, I was treating my masseter. So I was still utilizing more units, but maybe using them in different areas. But we do see patients who sometimes develop tolerance over time. That's one of the reasons we really want patients to wait a minimum of 90 days between treatments. Every time you come in contact with the neurotoxin, your body recognizes as a foreign body, and we don't want you to keep coming in over those 3 months. The chance of resistance is much higher. So there are some patients, the amount they start, they continue on the same amount for years. Other patients require escalating dosing, and then other patients may require less amount or decreased dosing with time. I think the first time, most of our patients, they're hesitant because they think it's going to be a painful procedure. So when we have the patient come in for the first time, obviously we explain the neurotoxins that we carry, we have them sign a consent, we talk to them about risk versus benefit, and then we do mark the area where we will be treating. We then have them numb with an ice pack, and the ice is actually really good for analgesia in the area. We then use very tiny insulin needles, very, very small needles, and we use several needles. So once it goes through the skin, we're not puncturing the skin several different times and going down to the muscle. So we try to make it as painless as possible. We have some patients who have a very high pain tolerance who don't even want the ice. We have others that will want the ice for a minute or two before we start injecting, or I even have some between each individual injection, they'll want to ice the next area that we're migrating to.